A lot of people, without even realizing it, are having a perfectly healthy tooth extracted just because it's called a wisdom tooth. Hi everybody, I'm Dr. Myrna, a dentist, and in this video I want to clearly and honestly explain which wisdom teeth should not be removed at all, and by the end of the video I'll tell you exactly when removing a wisdom tooth is truly necessary. One of the most common questions almost everyone asks their dentist is, do wisdom teeth always have to be removed? Because a lot of people grow up hearing that wisdom teeth are a problem and that sooner or later you'll have to get rid of them. But the truth is, a wisdom tooth is not a bad tooth by nature. A wisdom tooth is actually just like any other tooth. It's simply the last one that erupts, usually between the ages of 18 and 25. The problem usually starts because in most people the jaw doesn't have enough space for the tooth to grow in properly. When there isn't enough room, the wisdom tooth may come in crooked, stay partially trapped under the gum, or not come in at all and remain completely impacted. So let me say this clearly from the beginning. There are situations where you do not need to remove a wisdom tooth. If a wisdom tooth has grown completely straight, is aligned with the neighboring teeth, has fully erupted through the gum, meaning it looks and functions just like the teeth next to it, isn't tilted, and isn't partially covered by gum tissue, and if you can brush it easily without food getting stuck around it, then there is absolutely no medical reason to remove it. In those cases, a wisdom tooth works just like any other teeth. It helps with chewing, distributes biting forces more evenly, and can actually reduce pressure on the other teeth. Many people have perfectly healthy wisdom teeth that stay in their mouth for years without causing any pain, inflammation, or infection. Some people don't even notice they have a wisdom tooth at all because it's easy to clean and doesn't decay. In some situations, if neighboring teeth are lost for any reason, a healthy wisdom tooth can even partially compensate for that loss. So just because it's called a wisdom tooth or because it erupts later in life doesn't mean it needs to be removed. As long as it's healthy, cleanable, and not damaging the surrounding teeth or gums, keeping it is completely reasonable and safe. So the idea that everyone must remove all 4 wisdom teeth is simply a myth. That said, even if your wisdom tooth isn't causing any problem right now, it still needs to be checked periodontally. Oral conditions change over time, which is why regular dental checkups every 6 months should never be skipped. What really gave wisdom teeth such a bad reputation are the problem that causing many people. One of the most common issues is partially impacted wisdom tooth, meaning part of the tooth has come out, but the rest is still trapped under the gum. In other words, the tooth hasn't erupted fully upright and in line with the neighboring teeth. It's angled. The part that manages to come out is visible, but the rest remains stuck under the gum and can't erupt. In this situation, a small pocket forms between the gum and the tooth, which becomes a perfect place for food and bacteria to collect. The result is pain, swelling, bad breath, and recurrent infection. Many patients say that every once in a while the gum in that area swells up and then settles down on its own, but the problem keeps coming back again and again. Another situation that makes things even more complicated is when a wisdom tooth grows horizontally instead of vertically. Instead of coming up like other teeth, it lies sideways and presses directly against the tooth in front of it. This pressure can cause decay in the neighboring tooth, root resorption, and even jaw pain. In these cases, surgical removal of the wisdom tooth is absolutely necessary. One important thing you should know is that pain from a wisdom tooth doesn't always feel like it's coming from that tooth itself. Sometimes the pain radiates to the ear, the temple, or spreads across one side of the face. As a result, patients often think the problem is coming from somewhere else. That's why many people tolerate the pain for months without realizing that the real cause is an impacted or partially wisdom tooth that needs to be removed. Some people also think that if they take antibiotics a few times and the pain goes away, the problem is solved. But antibiotics only reduce inflammation temporarily. The main cause is still there. That's why the pain and infection usually come back after a while, sometimes even worse than before. So how do we accurately determine the position and the angle of a wisdom tooth or whether it's damaging the neighboring tooth? Through radiographic imaging. That's why a panoramic X-ray, also known as OPG, is essential when evaluating wisdom teeth for extraction. Another common question is whether it's better to remove a wisdom tooth earlier or wait Generally, at a younger age, the bone is softer, so extraction is easier and healing happens faster. But this does not mean that every healthy wisdom tooth should be removed preventively. The right decision is always based on each individual's specific condition. However, if a dentist has clearly determined that a wisdom tooth needs to be removed, the procedure is usually easier at a younger age compared to older adults. Another frequent concern is whether removing a wisdom tooth affects facial shape or jaw appearance. Under normal circumstances, wisdom tooth extraction doesn't change the shape of the face at all. Any changes people notice are usually due to temporary post-surgical swelling, which completely resolves within a few days. So there is no need to worry about that. On the other hand, oral hygiene is even more important for wisdom teeth than for other teeth because they're located at the very back of the mouth and harder to reach. Inadequate brushing or not using dental floss can quickly lead to decay or gum inflammation around them. In many cases, the problem isn't wisdom tooth itself, it's improper cleaning. Many people are afraid of wisdom tooth extractions because they have heard scary stories. The reality is that wisdom teeth are removed under local anesthesia, so you're completely numb and the procedure itself is not painful. Pain and swelling afterward are temporary and can be well controlled by following proper post-operative instructions. What really matters is this. If a problematic wisdom tooth is not removed on time, it can cause pain and infection that are far more severe and distressing than the extraction itself. So the story of a wisdom tooth isn't scary, it just requires the right decision. Neither ignoring the problem nor rushing into extraction is the answer. A simple examination can prevent a lot of future trouble because the mouth isn't just a part of our body. The mouth is the mirror of our body.